CDC says most Americans no longer need to wear a mask indoors. This comes as COVID-19 cases have plummeted and states and businesses have dropped their mask requirements. The Fox Medical Team's Beth Galvin joins us live with this news that's just in. And Beth, the CDC director just announced this minutes ago. So why now? Why this change?
Well, Christine, the CDC is really kind of reassessing as the case numbers drop, and you mentioned they're sort of changing the way that they measure the risks of COVID-19 on a community level and when we need to wear masks and take other precautions. So what they're doing is instead of focusing on case counts like they have in the past, they're going to be looking at things like hospitalizations, how many people are ending up in the emergency room, how many people are ending up in the ICU because of COVID-19. And so to help Americans figure out, their risk at a community level, they've created this new feature on the CDC website, and it basically allows you to go there and check your county risk levels. And it's measured in green for low, yellow for medium risk, and red for high risk. And on the map, about 70% of Americans are living in an area that is considered either low or medium risk. And the CDC says if you live in one of those areas where your risk is low or medium, you no longer need to wear a mask indoors. If you're in a higher risk area, a red area, you need to wear a mask indoors. Much of the metro Atlanta area is green, meaning low risk, meaning no masks under the guidelines. And so Dr. Rochelle Walensky says they've been working on this new mask guidance for quite some time as governors have increasingly dropped their mask requirements. And they've been asking the CDC for some guidance on this. And she talked about that.
Certainly, we know that many governors made announcements several weeks ago, but many of those announcements actually were phased in and in fact didn't acutely say that we're going to take masks off, but they were going to take masks off at the end of February or in early March or in the middle of March. So I would say our guidance actually probably very much intersects exactly where many of those phased approaches are going to be, in that many of those governors, when their policies are at play, will coincide with exactly what we are recommending.
So under these new guidelines, again, if you live in a low or a medium risk area, you can go without a mask indoors. But if you're in a medium risk area and you're somebody who has a higher risk of complications, if you did catch the virus, they recommend talking to your healthcare provider about whether or not you need to wear a mask. But if you're in a red zone, you need to wear a mask. But much of the country is now either green or yellow, indicating either low or medium risk of COVID-19. So we're seeing big changes on that map and how they redefine this, Christine. And, so fewer masks.
Yeah, I think a lot of people are excited about that. So what about this, Beth? There are certain circumstances when the CDC is saying you should wear a mask. What are those circumstances?
Yes, and so there's three of those there. So one is if you have symptoms, if you're having COVID-like symptoms, flu-like symptoms, you should be wearing a mask at this point. And also if you've tested positive for COVID-19 or you've been around somebody and had close contact with them who has tested positive for COVID-19, all of those in all of those situations, you should be wearing a mask and following the isolation or the quarantine guidelines. And then also folks who are immunocompromised, who would have a harder time fighting off this virus, they too should be talking to their healthcare providers about wearing a mask. Christine?
Okay, good stuff to know. We're having to live with the disease at this point, right?
Yeah.
All right.
Yep, absolutely.
Okay, Beth Galvin, thanks for bringing us that news so quickly. We appreciate it.